Thank you all for joining us this afternoon. My name is Max Nichols. I'm Policy Manager at the Sport and Recreation Alliance. So we were involved with kind of facilitating the drafting of these guidelines. So it's great to have you on board this afternoon. And just a quick piece of admin before we kick off, if you could stay on mute. It's quite a big group, so there'll be an opportunity for questions at the end, but if you could stay on mute for now, that would be great. So this is the first session of 2 webinars we're running over the next week or so. So today we're going to be looking at a bit of background to the guidance, how they were made, the work of the drafting group, and then we've got another session next Tuesday, and we'll put the link in the chat to those who haven't signed up for that but are interested, so with a couple of our corporate partners, looking at some of the legal and insurance implications of this work, and also a case study from British Cycling on the work they've done to kind of take things to the next step. So all I'd say is, as we go through, if you've got any questions, please do put them in the chat. I think that the team are going to answer things as we go. If they're kind of straightforward ones, or the more meaty questions, we can probably get to at the end, and I'll keep an eye on things. We'll have plenty of time to take questions at the end. So just to introduce our kind of panel today, so shortly we'll be hearing from Professor James Calder, who is chair of the expert drafting group, and also Dr. Pippa Bennett, who's director of clinical governance at UK Sport Institute, and also Paralympic chief medical officer. We were due to be joined by Jerry Hill from British Horse Racing as well, but unfortunately Jerry's ill today, so you're well covered by James and Pippa, and I'm sure we'll be able to answer all of those questions. But before I hand over to those two, I'd like to introduce Heather Sinclair, who's Head of Diversity and Sport Integrity at DCMS, just to give a bit of background to how we've got to this point, I suppose, and some of the government's wider work on concussion in sport, and the background to the guidelines. So Heather, over to you.
Thanks very much, Max. Good afternoon, everyone. Lovely to be here. Thanks for having me along. I just want to say a few words, really, as Max said, about these first UK-wide concussion guidelines for grassroots sports, which we published in April this year. The government pledged to introduce national guidance to help prevent and manage concussion in sport as part of our action plan on concussion, which we published in Parliament. Now, I know you all know this, but sport is obviously great for physical and mental health. It brings friends and communities together, and we want to protect that and encourage more people to be active. And the vast majority of people participate in sport safely, but obviously head injuries in sport do happen. We want to reduce the risks associated with concussion and make sport even safer for everyone. Ultimately, we want more people to participate in sport and have a really positive, enjoyable and safe experience. So the concussion guidance that we're talking about today is designed to be a tool for many people who enjoy sport at a grassroots level. It's intended to help people spot the signs of concussion and give them really simple to follow guidance about what to do. And we want this guidance to make a real difference to people all across the UK. So I'd like to thank Professor James Calder, who you'll hear from shortly, as well as the really valuable input from the SRA, as well as Lawrence Geller, who is our advisor on concussion in sport, and the whole of the expert group who gave their time so generously and their expertise when they were drafting the guidance. The work builds on the world-leading work that started in Scotland, and we want to raise awareness of the issue across the UK, as we said, and make sport safer for everyone who take part. Scotland was the first nation in the world to produce guidance like this, covering all types and levels of sport. So pay tribute to them for their efforts and for their cooperation and work in helping us with this UK-wide guidance, as well as the other home nations. So to finish, I hope you enjoyed today's session, and we look forward to continuing to work with you in the future to help make sure that sport continues to deliver positive health and wellbeing benefits for everyone. Thank you. Back to you, Max.
Thank you. That's really useful introduction, and I'm going to hand straight over to James because you'll want to get into the detail, and I'm by no means a concussion expert, so I'll hand straight over to James, who are going to talk you through the work of the drafting group, and together with Pippa on the background to the guidance more generally. And as I said, do put questions in the chat as we go through, and we'll pick those up at the end. So James, over to you.
Hi there. Thanks very much indeed. My name is James Calder. I'm actually normally an orthopaedic surgeon and run the bioengineering at Imperial College in London. So I got involved in this primarily because I've been doing some work with DCMS for a few years now in Department for Health, but I'm not a concussion expert. I certainly wasn't before I started this process, but I was more an independent chair for this. So I'm going to share some slides with you. Can you see that okay? Is that okay? Good. So the guidance was brought up and was announced in April. And really, the background to this is that the Select Committee published its recommendations back in 2021. And we know there are so many people involved in sport, but actually we don't know yet how many sport-related concussions there are. There's an assessment, various different figures have been given, but it's probably somewhere between 600,000 or 700,000, because we don't realize how many of those actually turn up to a doctor or to an A&E department, and how many of these are just occurring out there and they're just being managed out in the community without any advice at all. So the aim of this guidance is very specific. It's basically guidance for those suspected of concussion in grassroots. We're not talking about the elite group. The elite is a very separate group of individuals who have a lot of medical backup. But the group with the biggest worry from my point of view, and also the committee's point of view, was actually the normal people out there who are participating in grassroots sports, and that may just be a children's playground. And what we aim to do is give practical advice on the acute management. So we're not going into the longer term effects of and the debate about head injury and acquired brain injury in the more chronic cases and repetitive injuries. We're talking about the acute management to get that right first time. We're very much aware that we want to encourage exercise and sport participation, as Heather just alluded to. We know from the Chief Medical Officer's point of view, it's something we need to promote. We saw that very clearly during the lockdowns, the mental and physical problems that it can ensue without having sport. And something I want to get over is that this is a live document. It is not something that's set in stone now. It will change. It will become out of date from the 1st of June. It probably became out of date, and it's something we're going to revise and we'll look at. We'll see. We're waiting for feedback, and we've had some feedback. And we will change the guidance as new science becomes available, as we get feedback saying, actually, we don't think this works in that way. Could you change the terminology? We are taking that on board. So it's not just something that's set in stone and we're arrogantly sitting there saying this is what has to be done. And the final part is that it is a much wider initiative. It forms part of a much wider initiative. There is there's a lot going on with the technology. There's a lot going on with research into the longer term strategy for concussion and acquired brain injury. And there's also something I'll touch on later on, the research going into how we can then build up getting regional centres involved for those who've got sort of the more serious concussion and the symptoms that are not going away. So the process for this was, why me, effectively? James Calder is an orthopaedic surgeon, he's a bioengineer, but I'm not an expert on concussion. I think it was made quite clear that in the Select Committee that elite sport should not be marking its own homework. That's one of the recommendations. And so I'm independent. I don't work for any specific sports organisation, although I do work pretty much exclusively in sports now. But I'm not owned by anyone, so I haven't got an axe to grind in any particular way. There's Recreational Sports Alliance hosted it. We formed a group of international experts, so it's very much a case of looking at a global issue and not just looking at what was going on in the UK. So we had a lot of people from USA, from Canada, across Europe, as well as the UK as well. We have included the different sports bodies to see what works, what doesn't work, get some influence from them. and also particularly important to make it UK-wide. So we included the governments from the devolved nations. Finally, with regards to that, we had to get all the other DHSE bodies on board. So when it comes to NICE, we need to make sure we can include it within NICE guidance and make sure it doesn't conflict with what's going on out there. And because we're using the 111 service, because it's impractical for everybody to get, to see a GP, and it's been practical to see a GP, and also it's unnecessary to see a GP. Most of these can be treated and managed out of the community. So we need to make sure the 111 service was on board. And also it's now been endorsed by the Royal College of General Practitioners and the Royal College of Emergency Medicine. They do not need any more people turning up unnecessarily to A&E with a simple concussion, if you can classify a simple concussion, but with a concussion that's going to get better very quickly. They don't necessarily need to go to the to A&E. And finally, it does utilise previous work. The Scottish were first off the mark this some years ago, following the rugby injury that was promoted over there, and they started this process a long time ago. So a quick overview of the guidance, which I'm sure you've all had access to, and I hope it's reasonably readable. Like I said, I'm very happy to take feedback on that because it is a changing piece of document. The primary purpose is really to promote recognition, so remove and protect. So the key thing is, if in doubt, sit them out. That was the slogan that was used in Scotland and has been used there successfully for many years, and I didn't see any reason to change it. So we've used the Scottish guidance of, if in doubt, sit them out. And then the idea is that it's important to contact a healthcare professional within 24 hours. That can be via 111, and this adheres to NICE guidance. Red flags will be monitored, and if there are any red flags, obviously then they need to go to A&E for urgent assessment. And there are 1.4 million head injuries seen in A&E every year. So it's not necessary for all head injuries to go there, for all concussions to go to A&E. And then it's really important to encourage an early progressive return to activity. Perhaps when I was an A&E officer and I look after head injuries in a hospital, if I'm an orthopedic surgeon, a trauma surgeon, but we used to tuck them up in bed and keep them quiet for a couple of weeks. And actually, we know that isn't the right way forwards. We need to actively manage these. Putting them into a darkened room, closing the curtains, and is not an active management, and they will take longer to get better. And then there's got to be an outsourcing. If there's a delayed recovery or no improvement, then that's when people should see their GP and also get an onward specialist referral. The next part of this comes to education. It's got to be a community responsibility. Everyone wishes to participate in sports, but it should be the participants, the other people in the team, the teachers, the coaches, the parents, etc. So it's not just the healthcare professionals that are taking this on. Yes, healthcare professionals are important for the assessment, but we've got to make this practical, because with the 600, 700,000 concussions each year, we're not going to be able to get all those seen in a specialist concussion clinic. And it really is not necessary. There's a certain number that will need to be seen by experts, but it's not everybody. And then we've got the really difficult task of re-educating and refreshing, and I'll come on to that a little later. So when it comes to return to activities, this is a controversial area. And if we look at the guidance that's come out recently, was just published recently from the concussion sport guidance, everyone's been trying to move away from giving specific times and when people should aim to return, because it's a very difficult subject to get on board. But what we've heard from teachers, from sport coaches, from those participating in sports is they need to have some indication as to when they should be returning. So it's not an exact science at all, but we had we took a view and had major discussions on when we felt it would be safer, not safe, but safer to return. And we really felt that overall, everyone came down to agreeing that there should be a minimum of 21 days before returning to contact sports participation in matches, and that should be a minimum of 21 days. because and they've got to be asymptomatic during that time. Now, this time will be regularly reviewed. That doesn't mean to say they shouldn't participate in sport before then, because this, as I see it, you show on the right there, there's a graduated return to education and sport summary which we produced to say that you should actually participate in sport and go through a graduated. But sports participation where you're likely to have a head injury, whether that's riding a horse, riding a bike, or playing rugby, all these ones need to be taken into consideration as very nuanced within the individual sports. I would just like to point out, as I mentioned earlier on, it feeds into a far broader approach. We see these frightening headlines all the time with lawsuits against the rugby authorities in different centres around the world. But actually what we're hoping is that this will actually now promote more research and more awareness. And there's a £9 million UKHSA grant, which has just been awarded now. So we've got some research in jointly with Birmingham, Glasgow and Oxford universities. And the idea is that we'll then be able to build regional concussion centres, which are being developed at the moment on the back of this. And they're actually not that expensive, because we know there is not a lot of money in the DHSC to be able to fund all these things, but actually there's not a lot of money that's needed to use these regional concussion centres. And those are being developed at the moment around the UK. There's also, I mentioned earlier on, as the innovation and technology, you may have seen that an app is being developed. The idea behind this is that we would love a red and green traffic light system, so that if Anna plays sport on a Wednesday and is injured, she can't then turn up on a Saturday to a different team and play sport there. She's actually got an app saying when she's available and when she's able to return to sport. And within that, we're building in methods to assess, and then the neurological assessment as well, which we can build into these apps for ocular motor assessments to see actually when they're recovering. So then you can flag things up that if they're not getting better, they may need onward referral, as well as when they're able to return. This also then feeds into data collection, really important, because we need to know how long people take to get better, at what point that we'd expect them to be better, and when they should be able to return to different types of sport. So there's a big data collection that needs to go on here, and that we hope will be integrated within the NHS. So in summary, these are the first steps. We need this guidance because it's crucial for the start of the process. In no way is it perfect yet. This is a work in progress, and we will develop it. But I very much hope it's going to promote debate and awareness of head injury. But there's also a bigger issue here, that it is being looked at for the management of non-sports related acquired brain injury. Next week I'm giving a talk with the Department for Education and the teachers, because a lot of schools are picking up on this, that they actually see children coming in to school who may have had a head injury for outside of sport, but at home, and how they can pick this up and promote the debate and promote further management. And Chief Medical Officer Chris Whitty has noted that they actually suggested in a meeting with him in Glasgow in March that this could actually be used in other areas, whether it's domestic abuse, whether it's road traffic accidents, health and safety, and other situations. So I think that it has promoted a debate, and overall so far the feedback has been very positive, has been very good from the various different end users and other experts in this field. We do need to have more health promotion, and it is a work in progress to get it on the NHS website. That is my task, and I'm making some progress. It's a little slower than I'd wanted to, but I think we are getting there. And I do promise, Heather, I'll keep on with that to make that happen. But overall, we know that if we promote sport and exercise, that's important. But if we actively manage these injuries, then they make a quicker, and they're more likely to make a full recovery. Because overall, the financial burden of acquired brain injury is huge, and if we can prevent that later, those later problems, whether that's returning to work, whether it's the long-term medical conditions that can ensue, that's what we really need to do, and we're nearly there. When it comes to the next steps, we've announced the guidance. We are reviewing that guidance in September, and we're getting the panels all back together again to review the information we've had and the feedback we've had, and also to look at the new concussion in sport guidance that was published in earlier this month. And Jerry was going to talk about this, but basically we're sharing the information. We're trying to promulgate this through the different institutes, through Department for Education and Department of Health, to educate general practitioners, to educate A&E consultants and A&E staff, to make them aware of this and then review this and review the guidance once again. So it's not just the athlete, but it's all the family, people have to look after them, it's the club, ensuring that the clubs are confident. So the referee can stand there, and when they've got a very angry player, or the father or mother of a player who's being sent off because of suspected concussion, the referee can stand there and say, no, actually, I'm following guidance. This is good practice. This is why I'm sending that player off and getting them assessed. So I think that's who we're going to educate. What is and when probably slightly more difficult. We're working through that, and we've got some pathways with the Royal College of Surgeons and Royal College of General Practitioners to educate the doctors and the nursing staff as well on this. How that's being done is a slightly bigger debate, but certainly there's a lot being done out there. And although these are basic guidance, they are being adapted to your own individual sporting venues and individual sports. So although they're out there at the moment, these are the guidance, this is the basic guidance, they can be nuanced and they can be adjusted according to what you feel would be appropriate for your own individual sports. So I'm going to stop there, and I'd like to introduce Pippa, who is going to talk about the Amsterdam Consensus, which I was not part of. It's also made sure that I wasn't conflicted. We did coordinate ourselves and understand what was going on in the concussion in sport group. And in fact, there were people from the CI6G group who were involved in developing this, the guidance, the UK guidance. But it doesn't necessarily have to align with it, because it's very much a different approach. We're looking for practical approach rather than just purely a scientific, because otherwise we probably couldn't make many decisions at all. But Pippa, can I hand over to you?
Yeah, thanks, James. So just to give people a little bit of background, the Amsterdam Consensus was back in October last year, and this was the 6th consensus meeting there has been. This work has been going on for over 2 decades now. Amsterdam was a wee bit delayed because of COVID, but what we saw there in October, and I wasn't part of the groups, the expert panels, but I went to the consensus meeting in October. What we saw there was over 3 years of work to produce 10 systematic reviews of the evidence, of the research that has been produced worldwide, and the expert panels looked at those reviews, and then there was further peer review to produce the journal publications that have just come out this month. As James said, a number of the expert panel from Amsterdam were also our colleagues that were on the concussion, on the Grassroots guidance panel, and I think that was very important, so that we have consistency. As James said, they may not be exact alignment, because this is based purely on research and gives us guidance to how to manage a concussion. But the consistency is absolutely there in that recognise, remove and rest. So those are the key key messages, that whether you're playing Sunday League or at Wembley, that those are the most important messages that we have to get across to anybody playing sport. What Amsterdam gives us, and we are all doing exactly the same thing across all of our sports. We're doing it within the UK Sports Institute with our Brain Health Strategy Group, and we'll send out an email to all of these Chief Medical Officers of Paralympic and Olympic sports that we look after, that we are reviewing all these papers, reviewing the guidance, and then coming out to how do we operationalise this guidance within sport. And I know my colleagues in the professional sports are doing exactly the same thing. What these consensus gives us is kind of the next step and the tools that we need as as physicians, as physios who are managing concussion. So what it gives us are previously two things, and we have a new thing called SCOTE. So the first one is concussion recognition tool, and actually that's a 2-pager, and I'll show you that. I don't know how it projects onto the PowerPoint, but I'll show you that in the next couple of slides in a moment. And that's really a 2-pager of, again, aligning to actually what our Grassroots guidance says. It gives you what are the red flags, what to do when, and what things to look out for a suspected concussion, when to go to hospital, when not to. So that's for use of everybody. The SCAT, if we go, yeah, we can go back one slide, just keep it on that for a sec, thank you. The SCAT, which is the Sports Concussion Assessment Tool, so it's not a standalone diagnostic, but it helps us. It's a tool that we use to assess a concussion, and that is what you should be expecting. For example, if you had any athlete going into A&E or seeing a doctor at any time, that's the tool that we use. And it's a tool that assesses symptoms, it assesses memory, short-term, long-term, it assesses balance. So it gives us a little bit of an indication, is this a concussion or not, and the severity, and then we can track sometimes the symptoms. What's new from Amsterdam is the SCOTE, which is the Sport Concussion Office Assessment Tool, and that is being designed actually to be after the 72 hours assessment. So your SCAT is the acute assessment within the first 72 hours, and SCOTE is after that. And that is it gives us even more of an in-depth look at, James mentioned it earlier, this ocular motor reflexes, vestibular. It goes into more detail with balance, and so it's going to give us a much better assessment of athletes, of people going forward. And they are also including child versions of the SCAT and the SCOTE. Next slide, please. So this is broadly, forgive me if it's probably blurred because we've but this is freely available, a concussion recognition tool, and so it can be printed off, laminated, put up in sports halls, wherever, to give people a reminder of what are the red flags, when do you need to call the ambulance, when do what could be the signs, the visual clues of a concussion, what kind of symptoms, because quite often people don't realize that you're feeling in a fog, for example, you're feeling increasing emotional. It can be a symptom of concussion. It's not just the obvious sort of headache and vomiting. And then some very simple questions, what we call the Maddox questions, that anybody can easily ask somebody to very quickly assess, do you know where you're playing? Do you know who scored the last goal? What was the score in the last game? And sports can adapt that. We had very different questions when I worked in equestrian, for example. I think lastly, before I sort of hand back, our understanding of this is continually evolving. Hence, there's we're 6 in with our consensus. And certainly as a practitioner, what I did 20 plus years ago, looking after Millwall footballers, is going to be very different to what I do, and well, hopefully not do in Paris Paralympics next year. Hopefully I don't have to see any concussions, but it will be I'll take a very different approach. And I just wanted to say one thing on para, as I'm Paralympic CMO, is that I was very keen in the grassroots concussions. All of the research is, I say all of the research, it is done on non-disabled people. So we had to put in, I felt, a line in our graduated return to play in the grassroots guidance to say, for people with disability, it has to be an approach that is case by case. So we use different assessments for somebody with a disability than we do with somebody without. However, the initial, as I say, recognize, remove and rest those are the key things for everybody. But when you're talking about when do you get somebody back on the pitch, back on the court, and certainly within parasport recently, we've had some complex concussions with our para athletes, and they have to be dealt with individually, and that's beyond the scope of a general guidance document for now. But it's something that we are looking to influence. We need more research for our people with disability, and we are working on that. Back to you guys.
Thank you both, Pippa and James. That's really helpful kind of overview. Just to say, I've put a link to the CRT document that Pippa was referring to in the chat. So there's a PDF available there for you to kind of download and take away, as Pippa said. And just to say thank you for picking up on the question of disabled people. It was a question we'd had in advance for me in a British Blind Sport. So yeah, hopefully that, I don't know if Ian's on the call, but hopefully that helps to answer the question that, you know, the broad principles of the guidance are applicable for all, but as Pippa said, that the return to play is a bit more nuanced for people with different disabilities. And also, Ian did also ask about an accessible version of the document itself, which is certainly something we're looking to do. So we'll pick up separately on that, but it's certainly something we're keen to make available as accessible as possible. Just to pick up on some of the comments in the chat, and if anyone's got any questions, please do either put them there or raise your hand, and we can hopefully have a bit more of a discussion if people have got questions. But Chris asked around motorsport. I think the principles of this guidance are it is cross sport, and it's obviously designed not to be specific to any individual activity, but as James said, very keen for people to use the guidance and build on it and nuance it appropriate to your sport. So I think that's the intention here, is that these are the kind of the broad principles, but fully appreciate that within each activity, there are things that will look different, and different risks and challenges, etc. So hopefully, it's not a case of within development picking on certain sports to engage with. It's more a case of trying to make things as broad as possible at this point. But as we progress things, very keen for people to use as appropriate. And as James said, happy to kind of pick up individual conversations separately. Question from Helen around opticians. So I'll just read this out. Have opticians been involved in this around eye muscle weakness? Can be relevant issue post head injury, can lead to difficulty reading. I don't know, Pippa or James, whether that's something that's come up.
We've had involvement with neurologists, obviously, and the concussion experts. It's interesting this though, because what this debate has highlighted is actually patients are presenting in different ways. So we were talking about school earlier on. They may have had a concussion which hasn't been recognised at home, hasn't been recognised when they fell off their bike, but the teachers may be picking this up. Johnny or Sarah isn't quite normal at school, isn't attentive and things like this, and they're actually picking it up. So in a similar way, some patients may be going to they've got reading problems, and they go to the optician. So I think it's a crossover. We haven't specifically involved opticians, but the neurologists, we are aware of that blurred vision and things like this. We haven't specifically involved opticians or so, otherwise we will have a massive group. And it was hard enough trying to keep the marauding mass of people under control as it was, if I'm brutally honest, with very strong opinions. I have to say, I'm an orthopedic surgeon, so I'm fairly used to fairly boisterous, difficult individuals. But this group were quite exceptional in that regard. And have very firm opinions. So it's interesting. I think it has the good thing about this is it has provoked debate, and that's why I think it's not going to just be sport. It's actually crossing over into various different areas, whether it's transport, whether it's education, whether it's Department of Health. I know that at this point probably Heather's shaking her head going, "Oh no," but actually there's a bigger impact there. And from my point of view as a scientist, I think that's good.
Yeah, I come in as well. I think this piece of work was not looking at the rehab post concussion. It was, a general guidance for return to play. The rehabs, certainly the Amsterdam consensus really picked that up, and I think that's one of the sea changes that we're seeing, is that in exactly the same way we return to sport after an ankle injury. James is the expert with ankle injuries. We don't rest for 2 weeks and then suddenly think that you're going to do a 5K run. We gradually return and we rehab, and rehabbing the brain, if it's an eye issue, if it's a balance issue, etc., that's being addressed in the Amsterdam consensus, and that's what we're trying to work through, is to what do we put in place in terms of our rehab. I can pick up the next question as well, so I've got a special interest in males and females, having worked in women's football for 20 plus years. Is that what we know in the research is that women tend to take a little bit longer for recovery. We don't know exactly why, but that's what the research seems to be suggesting, that potentially women take a little bit longer in recovery. The research out there that we are more susceptible to concussion is now being questioned. I would like to say we're perhaps a little bit more honest in saying that we have some symptoms of concussion, and that has skewed some of the research before now. But we debated this in the guidance. Should there be a different return to the 21 days? And the consensus was no, that was equitable with the research for males and females. And just as an aside, we are looking into this in the UK Sports Institute and doing some fancy dancy work with hormonal testing and concussion. So there will be more research in the male-female gender approach to concussion, but the guidance is as is the research that we know now.
And I'll follow on from that, because I know there'll be another question about age groups. And in a similar way, we looked at whether we should be differentiating adults from children. And that's another area where we came down to the practical situation, that actually, there's a legal age for adult versus child, and that is variable. It varies in Scotland from England, but there's also an adult brain versus a child's brain. So actually, it just becomes incredibly complicated, and the science there is very inexact. So we have not differentiated at the moment, and we don't plan to at the moment unless there's specific science that proves that we should be differentiating it. There are differences in the recovery, we get that, but actually for this advice guidance, we haven't done.
Thanks, James and Pippa. Helen, I don't know if there's anything you wanted to raise specifically or not. I hope if that answers your questions, but just looking again in the chat, so Vicky from British Blind Spot, hi Vicky. So a question around, is there going to be, I think the question is there going to be kind of specific guidance aimed at either disabled people or people with visual impairments more specifically? Pippa, I don't know if you've got any, I guess, the thought was that this was a general guidance and people can take that and build on where appropriate, rather than having kind of a dictated guidance for different groups. But
yeah, and I think that's the right approach now, and I'll be completely honest, we do not have the research for specific impairments to be impairment specific, or even for VI. We simply don't know, and therefore the safest is the recognise, remove, rest, and then individual basis of return to play. That's as much as the research we have at the moment. But what I can say is that we're at it with the researchers around the world and the concussion in sport group to say we need more research for our para athletes and our disability groups. Hope that answers it.
Thanks, Pippa. Another question from Laura around, I guess, a discrepancy between what people may be reporting and what comes back from 111. James, I know you've been doing a lot of work with 111. It may be something you want to pick up.
Yeah, I think the first thing to do is we were very much aware there's a balance between promoting sport and putting people off recognizing and self-reporting the injury. Because some people said, well, you know, we don't think they should go back to contact sport for 3 months, say. Some people have said even longer. Well, actually, there comes a point where you're going to put people off, even, you know, saying they might have a head injury. So actually, I suppose it's a public health risk benefit and ratio. And we took some advice on this. So that's why we come down to 21 days at the moment. But there's also the thing whereby we've had some feedback saying it's been very difficult for club officials to send somebody off because they felt very pressurized to be able to say actually whether they have got a head injury. And we would much prefer a more conservative approach and a more cautious approach. If you think there's a head injury, if you think there's been a concussion, get them off the pitch. We do not want a second head injury, second impact syndrome scenario. So there may be the occasions when a player is sent off and said, no, don't return, go and get an assessment. And if a healthcare professional turns around and says, actually, no, this wasn't a concussion, then I put my hand up and say, sorry, you know, then we've been overcautious. But personally, if it was my child, I don't think that was overcautious. I think that was the correct thing to do. I understand Laura, you know, may think, well, there's some conflict there, but I think it's the right thing to do. And if you suspect there's a concussion, I think they should be removed and they should have a review with a healthcare professional. The paperwork side, I don't know what paperwork is needed within individual clubs. I know that the clubs that I've been associated with in Grassroots, whether that's local rugby clubs, soccer clubs, cricket clubs, there is a recording, there is a book of injuries and first aid. So I don't know what the recording is in individual clubs, and I don't know the legalities behind that, but I presume there is a recording somewhere that says there's been an injury in a match. I'll leave that to somebody else. But at the moment, it's caution is the way forwards. I think there could be further education. This is something that Niall Elliott up in Scotland is doing, and he's actually going around on a bus. And there's an education bus that goes around. It's not used at the weekend, so he's hijacked it for use in concussion, and he's taking it around to the different areas, the Western Isles of Scotland and things, to do some concussion education and stuff. Taking it to sports clubs to give education. I would love to do that. It would result in divorce. But I think that's something we could look at doing, and I think we need to get this out there and in some form of way of having sort of a spoken hub scenario where we've got a hub, and then we can go out to individual sports clubs to give some education packages. If you've got a way of doing that within the different sports organisations, that may be a more appropriate way. So sub-aqua clubs can do it, the sailing clubs can do it, at the individual things they have the first aid is responsible, they can know about it and they can highlight it. I think that's probably a better way than me going around the whole of the UK.
Thanks, James. So just to pick up again, a couple of more questions coming in, it's great. So in terms of a definition of contact or high risk sport, it's not outlined in the document, I don't think. I guess there's some onus on sports recognizing their own risks and communicating that to their participants. Is that correct?
Yeah. I mean, we all know that there's which sports are likely to have a contact. You'd be pretty unlucky playing tennis to have a severe, significant head injury. It may be different from others. And I think we did debate whether we could sort of try and define it, and it's just going to be too difficult. So it's up to the individual sports clubs to decide what their risk profile is, really.
Great, thank you. Edward's question around people coming from another sport. I think this is a really good point. There's something James touched on around where people are doing multiple sports. It doesn't even have to be, a sport concussion. It could be people who have a concussion doing anything else in their, in their daily lives. I think some of this is a general education piece around making people aware of the risks, so that if they have, sustained a concussion, they don't then turn up to your sport and wanting to participate and making people aware of that. I think also, as James touched on, the kind of technology aspects of this, hopefully down the line, if that gets to a place where we'd like it to, that would address some of these questions where you would be able to say, okay, before you participate, show me your record in the app, and if they've had a concussion elsewhere, then it would flag in there. So I guess that's the kind of the dual approach on that. But a lot of this is around making, whether it's parents or participants, aware of the risks and the process, so that they're not attempting to go through that road.
I think it is an education piece. It's a bit like, if you have a mild bend in sub-aqua, you wouldn't want somebody to go and dive the next day or 2 days later, and it's up to them to recognize the dangers in themselves. It's got to be up to them to take the risk. Children is different. I get you. That is difficult, but that's why I hope that if we can integrate the app within the NHS and it's NHS compatible, it also gives that also helps with the GDPR issues.
Great, thank you. Question from Robin around, do we know if sports such as football allow additional substitutes for head injuries or concussion? Pippa may have a view on this, but I think that the general principle of this work is these guidelines weren't intended to dictate on sports and their kind of rules and regulations, and it's very much for sports to use the evidence and make their rules appropriately. So it'd be up for football authorities to decide that. But Pippa, you may want to.
Well, for everyone's information, so I was my last job that I was at was medical lead for the professional women's game, so our top two tiers of the game in women's football, and we were part of a concussion sub pilot where it was permanent substitutions. So if in doubt, sit them out, they would come off, and a concussion sub was used, and the opposition was then given a free substitution. So there was no sort of advantage. And what this was hopefully doing was to enable the medics, as they did have medics on the sideline, to make that call. If in doubt, sit them out. It is still a pilot. It has been sanctioned by FIFA as a pilot. The women's game is part of that, and the men's game. And we are still in debate whether that is the best approach or a temporary substitution, as they have in rugby. It's an ongoing debate. When and if that comes down the line into change of rules in Grassroots, that's a TBC, because it's currently a pilot within the game.
Great, thanks, Pippa. And Heather, I think a question for you here around whether government has endorsed any particular app at this stage. I think the answer is no, but I'll let you answer that.
Yeah, the answer is no. We haven't endorsed any particular app, but James has alluded to sort of the potential for technologies to play a really important role here, and we're supportive of that. So yes, any app that kind of helps support this work, helps people manage and identify concussion is great, but we haven't endorsed any particular one.
There is a different work stream going on out there looking at this at the moment, and the Podium Analytics, there's been something that was announced in the press a couple of weeks ago, 3 weeks ago, is looking into this at the moment, but it's not a UK government one. It's just purely, it's being looked into to see what there are various different app companies out there. It's what would be practical and what can work and what can integrate with the different sports. And importantly, from my point of view, I want it to integrate with the NHS, and that's not an easy task.
Indeed, certainly not. There's a lot of moving parts on the technology front. I think that's all the questions in the chat. I don't know if anybody wants to come off mic and have any comments or questions, or if there's anything else, then please do put it in the chat. I think I'd just say, we appreciate, different sports are at different parts of their journey on this, and we're, as the Alliance, here to kind of help support you where we can. So we'll be for those coming to the next webinar, there'll be an opportunity to discuss this in a bit more detail, but we'll be looking at helping you take things to the next stage in terms of, as we've talked about, taking the guidance and making it applicable to your individual sports and activities. And we'll be getting some further comms out to you around how we can further support you going forward. But please do be in touch if there's anything specific. James, Pippa, I don't know if you've got any final thoughts. We've got a few minutes left, but
no, other than the fact it's as I keep on reiterating, it's work in progress, and we need your feedback. But also, I do need a way of getting this education package out there, and it isn't going to be funded by the central government. I'm not looking at Heather, but it's not your fault. But there is no way that this can. But we do need it sort of to be. I think the best way is to do it through individual clubs, and get back to me if you've got concerns. If you want to pass something by us and say, do you think this works? You know, I'm very happy to have a look at stuff, and we've got a team. Jerry unfortunately couldn't make it today, but he's really into the education side of things, and we're looking at the Royal College of General Practitioners, as I said, and A&E, and actually some of the work we're doing there is actually it's fascinating, because there's very little known about concussion. If you go and see your GP may be an expert in fertility and asthma and things like this, but very few have got expertise in concussion, which is why we need the regional centres, and which is why we need the education package for GPs. But I would really be very happy to try, and if you've got something you want to put as an education package for your individual clubs, let me know. And as somebody's just put in, recorded module, yeah, that's what we hope to do. Actually, we hope to have some recordings to have an update, and then have every year. Well, actually, this is the package for concussion. These are the updates. This is what's changed. This is the science that's come in now. I'd like to have that every year, because the science will evolve slowly, but that's for another time.
Last one from me would be that, you know, we've got, I'm certainly aware of a couple of sports, and it's great you've got cycling on the next call, who have, you know, developed things already across their whole sport. Cycling is one. I'd shout out to Jim Ayres at British Equestrian of trying to get that message across from, you know, our Paralympians, Olympians, funded athletes down to Pony Club, and having that sort of mantra, if in doubt, sit them out, across the whole spectrum of that sport. And, you know, many sports are looking to, I'm very fortunate working in elite sport, but using those elite athletes to be role models as well. And certainly when I was working in football, we were looking at that as well, to make sure that our players were role models, and, you know, and the messaging from that elite end of the pitch was then filtered down, so that kids did realize that it was okay to come off because you were concerned about a concussion. And there was also work with our pundits as well to reinforce that on TV in football. So there are some very good illustrations of the work actually happening. So yeah, we're getting there slowly.
Great, thank you, Pippa. And James has just answered the question around slides. Yeah, so if James is happy, which I think he is, we'll get those shared with you following this. So finally, just for me to say thank you to James, Pippa and Heather for your time this afternoon. Really great discussion, and thank you all for joining, and do let us know if there's anything else we can help support you on going forward. And for those that are coming to the session next Tuesday, I look forward to seeing you next week. Otherwise, have a good afternoon and evening, and speak soon.